Hello, everyone. Welcome to Accreditation Unpacked webinar focusing on open disclosure. Today, we're just going to give our audience enough to join. Before we start, we'd like to acknowledge the traditional owners of the land upon which we're all meeting today and pay our respects to their elders past, present and emerging. And can we please also use this opportunity to remind ourselves of the important work that we do in our everyday working lives to make a difference and to close the gap for our Aboriginal and Torres Strait Islander patients. Thank you. Now, I hope everyone can hear me okay. We'll do a little bit of housekeeping if that's okay. And to get the most out of today's session, there's a little section down here on the side panel of your screen on the right-hand side where you can put any chats in the space there that you've got. You're also very welcome to come off mute as we talk, and I'm very, very happy to take questions as we go along. So thank you so much for your patience with us with this today. So without any further ado, I'd like to introduce myself. If we can go along to the next slide, please, Alex. My name's Amanda Ginger. I'm a registered nurse. I'm an accreditation lead auditor. I do accreditation to the national standards, the digital mental health standards, primary and community, NGIS, you name it, I do it. And I also do consulting as well. So all I do, it's fair to say, is work in the accreditation space. Today, we'll go on to the next slide. The agenda that we're going to look at today, we're going to talk about open disclosure for accreditation. Then we're going to discuss what is open disclosure, the different forms that it takes, because a lot of people think open disclosure is only for very serious incidents and complaints. Who should perform open disclosure? Then I want to talk about the duty of candour in Victoria. Now, if you're not in Victoria, I still want to talk about it because I think it's a really good system they've got there, and you might want to have a look at that for your organisation. And then open disclosure training. Thank you so much. We'll move on to the next slide. So before we discuss open disclosure in detail, I want to point out to you that in addition to open disclosure being best practice for complaint and incident management, it's also a requirement for numerous jurisdictions such as our Departments of Health, Aged Care Commission and other organisations like that. It's also a requirement for all the accreditations, so National Safety and Quality Healthcare Standards, or the national standards that we like to call it, the Primary and Community Healthcare Standards, the Digital Mental Healthcare Standards, the National Clinical Trials Governance Framework, and it's also a requirement for the upcoming Cosmetic Surgery Standards as well. So what does all this mean? Well, not only is it just a necessity, but it's also an industry expectation. Now, none of us go to work to do a bad job, and occasionally things go wrong, right? So our patients want to know that when things go wrong, that they want to know that we're going to tell them about it and what we're going to do to make it not happen again. So whilst we're going to talk about open disclosure and the evidence base around it, please don't forget that fundamentally this is just the right thing to do, right? It's the right thing to do. It needs to be part of our core values in healthcare. It's also part of the aged care standards, and it's intended to be used by all Australian healthcare services. So that means even services in rural, remote, subacute, primary community, mental health services and small practices are also encouraged to use the open disclosure framework for their service. Thanks so much, Alex. We'll move to the next slide. So we've got here I've used the 112, actual 112 for the national standard, but basically across all the standards, there's some sort of open disclosure requirements, right? So if you're working on the national standards, it says that we need to be using a program that's consistent with the open disclosure framework. So we're going to take a deeper dive into this framework shortly. But first, I just want to highlight that part of working in this action, actually, we need to look at the term their users. That means that more than just having a policy, we actually need to embed our policy and make sure we've got a system that works. So this is really important. If you've got a small service that hardly ever uses open disclosure, it's really not enough just to have a policy that no one knows about, if that makes sense. So not only do we need the policy, it needs to reference, if you like, the open disclosure framework or another evidence base. So you might refer to the CEC or Safer Care Victoria, something like that. And some of the other actions in the standard, some other standards, have additional requirements for open disclosure. So, for example, if I'm doing, say, clinical trials, then it's a requirement that I have clinical trials disclosure as well. So then the next part of this action states that we need to monitor and improve the effectiveness of the process. And I've got a really good view for that later on in the talk that'll help you get through that. Now, I'm going to make the assumption here that a lot of people here today are working for organisations that haven't needed to perform open disclosure before, and that's great. Sorry about the noise. But you still need, however, like I said, a system to make sure that you monitor the effectiveness of it. So, for example, do you have a section in your complaints? Do you have a section in your complaints system where you can record that open disclosure's taken place? You've got a small service that doesn't do open disclosure very often. How do you know that open disclosure is occurring if you're not keeping records? So if you don't know that it's occurring, then obviously you can't evaluate the effectiveness either of it. So if you're a service that's not needed to perform open disclosure, again, I urge you to review your system and processes sooner rather than later, so that if unfortunately you're in a situation where an open disclosure is needed, then you should be able to grab what you need, have the staff already educated and run with it. So part of the effectiveness also of your open disclosure program surely needs to be complying with whatever other jurisdictions you need to comply with. So for example, in Victoria, for public hospitals, they also need to comply with the duty of candour requirements, and we're going to talk about that later. So thanks, Alex. We'll move to the next slide. So what is open disclosure? Well, basically, an open disclosure is a discussion that you have with the patients whenever a patient suffered an adverse event. So it includes an apology, an explanation of the incident without apportioning blame. And that's really important because that's where our healthcare workers get really nervous. We don't want to be apportioning blame and getting down the legal track. Patients are to be provided with information about what happened in a timely, open and honest manner. Now, health services should also ensure that staff members are supported through this open disclosure process as well. So this is important because timeliness and giving open disclosure for all incidents is important because it's not just for our show-stopping incidents. I'm doing work at the moment for an organisation at the moment that's had a lot of falls, and next to the list of incidents for the month that they're looking at, it's got a not applicable next to the open disclosure column, and that's not correct because there needs to be a lower level of open disclosure for all incidents. So even where there's little to no harm, we need to do a lower level form of open disclosure. So open disclosure, of course, is also part of our Australian Charter of Healthcare Rights. We've got a right to be told what went wrong with our healthcare, how it happened, and how it may affect us, and what's being done to make sure it's not going to happen again. We've also got a right to share our experiences and participate in quality improvements. And we've also got a right to ask questions and be involved in open and honest communications. And finally, we've all got a right under our Australian Charter of Healthcare Rights to provide feedback or without fear or affecting the way that we're treated. So remember as well, we're not just workers in the healthcare system, we are also ourselves consumers. Thanks so much, Alex. We'll move on to the next slide. So there's 5 elements of open disclosure, and they are an apology, an expression of regret, which should always include the words "I am sorry" or "we are sorry." It's an open discussion of adverse events that result in harm to a patient while receiving health care, and it's done with the patient, their families and carers. Timeliness needs to be part of the open disclosure, and hopefully you'll put that into your policies. Hopefully after today you'll go back and have a look at your policies and see if they need a little bit of zhuzhing up. The Commission suggests initial discussions within 48 hours if you can, and that's from being aware of the incident, because sometimes we become aware of incidents of harm occurring afterwards, so it's not always immediate, and we need to make sure that we're open and transparent during the process. Open disclosure is actually a really simple process, and it's about, like I said before, doing the right thing, and it often makes us as staff feel better too if we could just very quickly and timely tell people we're sorry and work towards trying to fix things. Thanks, Alex. So you'll see here, this is a picture of the open disclosure framework. So if you're going to review your policies, your processes, it's still the 2014 framework that we need to use. It's still available to download online. And as the slide says, it was actually endorsed by the Australian Health Ministers, which is a good thing to know. This is your master document to start off your research into open disclosure. In addition to looking at this document, though, it's really important that you have a look at your requirements for your jurisdiction. So I'm in New South Wales at the moment. I'd have a look at the CEC, that sort of thing. WA, you go for the WA Health Department, that sort of thing. So you want to have a look to see if there's any other requirements for your jurisdictions that you need to know about. There's also a document from the Commission that is an open disclosure framework for small services. And the Commission also did a review around about 2020, I think, so you can have a look at that document as well if you're interested. There's also additional resources, really good resources from the Australian Commission on Safety and Quality in Healthcare on their website, and that includes a checklist to do open disclosure, documentation to follow and to do reports on, and those sort of templates. There's also, and this is your secret weapon, there's an open disclosure organisational readiness assessment tool from the Commission, and reach out to us at QIP if you'd like a copy of that, or go on the Commission website and find it. And I'm going to talk to you about this later because, like I said, this is your secret weapon to get ready for accreditation. Thanks, Alex. We'll do the next slide. So, principles for the open disclosure framework that we've got there. Number 2 is acknowledgement. I wanted to just highlight that because we actually need to admit that an error has actually occurred, and sometimes that's easier said than done. So, for example, an organisation I worked with a while ago had a group of elderly people. So they had it was an NPS. So they had some aged care residents, and one of the residents hadn't been out of their room for 2 years. And they'd like to say that the resident hadn't been out of their room for 2 years due to depression. However, that was still an issue. So that's where I mean, we need to admit that there's something wrong rather than just coming up with a reason why something happened, if that makes sense. So here's the 8 guiding principles. Whilst the list actually a really good idea to make sure whatever processes you've got in your organisation or you're going to put in your organisation are formalised, because if you can imagine, especially if you're not doing open disclosure much, or if your organisation has never done it, obviously when things go wrong and you need to do a high level open disclosure, nerves can usually be high, and it's really good to have these principles included in your policy and processes and made it easy so that if I'm the clinician doing the open disclosure, I've got something easy to follow. Thanks, Alex. So now we're going to talk about the actual open disclosure process. But first, can I please ask you to think about what your processes are currently? So as I hinted before, if you don't already have really good processes currently for open disclosure, then my suggestion is that you add open disclosure straight away to your risk register, and then schedule time to do a little project to update this and to make this good. Imagine I'm working at your organisation tomorrow and I need to perform an open disclosure. I'm going to ask you these questions, right? This is to see if you're ready. Have I had training in open disclosure? And that's not just open disclosure training like online. What I mean is, do I know how to actually recognise incidents? Do I know when I need to do open disclosure? Do I know when I'm at the stage of needing to start it? Then I'm going to ask you, have you got a policy on open disclosure? Is your policy current? Is it evidence-based? And also, do I know how to access it? Because oftentimes we've got policies and procedures and people on the coal face, the clinical areas, aren't accessing them. Then I'm going to ask you, have you got a checklist or something that I can follow that's going to assist me in the process? Because I might be really nervous doing this. This could be my first time. So have you made it easy for me? And then finally, I'm going to ask you, can you defend your current process to your regulator, so your Department of Health, or even court if you had to? So now that we've talked about that, the process now is that I detect and I look into an incident and I decide that I need to have either a low level of or a high level of open disclosure, and we'll talk about the differences shortly. If a high level of open disclosure is required, then I need to prepare for the disclosure, arrange a meeting with relevant patients and carers, get my facts together. After I actually do the open disclosure, then I need to follow up with, and by that I mean following up with the patients, the staff, what improvements I said I'd do, have I actually done them, what further investigations need to be done, that sort of thing. So there's a lot of follow-up that needs to occur. Completing the process now not only involves following up with everybody, but I also need to make sure that I've included any quality improvements in my quality improvement system. So I might have a quality improvement register. I need to report it in minutes of whatever meetings I have, like quality meetings, report up to my board and my executive. So I need to dot all my I's and cross all my T's. My documentation needs to be meticulous, and also continuously document on my incident report, for example, about what I've done. So think about when you're writing documentation after an open disclosure process or any incident reporting really, think about doing your documentation with patient in your mind or as your audience, because an open disclosure done well will mean that I'm going to give them maybe a written report about what we've discussed, and also remembering that they can also, through freedom of information, they can get a copy of all this stuff anyway. Now, within the open disclosure framework, there's a nice flow chart, and I'm just going to ask you to go to the next slide, please, Alex. And this slide you should be looking at now is hopefully the high-level open disclosure flow chart, but also in the there is a chart, the start of that chart talks about a low-level open disclosure. Now, this is where if I've got a lower-level disclosure is what I do when I've got an incident that basically has a lower level of harm, usually. So an example of that might be if I've had a fall, I've got a patient with a fall and they've had little or no harm, I'm going to do a lower level open disclosure. So for this lower level, I'll acknowledge the fall, I'll speak to the patient, and I might say something like, hey, we need to work together here to make sure you don't fall again. I need to maybe ring their next of kin, document in the notes and the record, ask the patients their views. Were we doing something wrong, for example? Do I need better lighting? Did I have their cot sides up and they couldn't get to the toilet, in time, that sort of thing. So whilst it's unfortunate that something's happened, I'm going to do my best here. I'm going to apologise, we'll learn from it, and then we'll continue on. And this happens all the time, and we might not have been calling it a low-level open disclosure, right? So for a higher level open disclosure, there's this awesome flow chart that's in your open disclosure framework. If you haven't got it in your policy at the moment, I highly suggest cutting and pasting it into your policy so that clinicians can follow it. And here we've got the higher level response. So this is for, unfortunately, when we've got more harm, and this is the process that we follow. So other things we need to consider when we're doing the higher level disclosure is to think about things like, do our patients need maybe an advocate or a translator? Our patients that we're doing the disclosure to might not have anyone to sit with them and be with them. Consider where you're going to do the open disclosure as well, like privacy is an issue. You might have a private area in your service, or it might even be on the phone or video conference in some circumstances. Remember too that patients and their families can still put in a complaint, they can still seek legal advice. Just because we do an open disclosure, it doesn't take away any of their rights. And again, there's some really great fact sheets for consumers on the Commission website. So if you haven't got those consumer sheets ready to go in, a little pack for open disclosure or in your policy, think about putting that in easy to grab places for your clinicians, because that's really good for them to work at as well. Thanks, Alex. So, so resources. There's, like I said, really good resources from the Australian Commission on Safety and Quality in Healthcare. There's really good fact sheets. There's booklets for patients. So again, I always suggest to people that you have all this ready to go in a pack. So if you need to do an open disclosure, that the clinicians can just grab it and it's nice and easy for them. Thanks, Alex. So who should perform open disclosure? I always like to include this slide because it always reminds me when I'm working in private, I want to be careful about who's doing open disclosure. Private services need to be a bit careful because if you've got visiting medical officers, you want to know if they're doing an open disclosure. You as the organisation need to be there to hear it as well, right? So who should perform it? My suggestion is that for high-level disclosures, you always have the discussion with the executive of your service. So like I said, the executive needs to know that it's going on and who's doing it. And in some cases, incidents can be so serious or involve multiple and complex issues that sometimes local health districts or even boards could become involved in disclosures. So, for example, I've worked with another service that had, again, history of elder abuse, historic history of elder abuse, and the level of disclosures was so high that board members actually had to become involved in the disclosures. So, again, if you've got an organisational readiness checklist that you can use, this will help explain this to you about who should be doing this. Thank you, Alex. So I wanted to talk about the open disclosure and duty of candour as well. So in Victoria, for those of you that aren't working in Victoria, in public health system or service, the duty of candour became new legislation in November 2022, and it actually extends on open disclosure. And under these requirements, duty of candour means that basically the patients get an open disclosure in a really strict time frame. So it also, the duty of candour legislation actually gives the workers and the health services some more legal protection, if you like, as well, around the open disclosure. But why I would really recommend, if you're not working in Victoria, is to please go on the Safer Care Victoria website and have a look at all the information around duty of candour, because they've got really good tools that you can use. So, for example, they've also got checklists about how to do the apology, timeliness. They've also got checklists about even getting together the meeting with the patient and the family, around planning the meeting to have the open disclosure. And they've also got meeting templates and report templates that are absolutely outstanding. I love the time frames that go with the duty of candour, and you might want to think about putting those time frames into your service as well. So again, the next slide talks about the different stages of duty of candour, which is still very highly aligned to the open disclosure framework. But again, even though this is very formal, just remember too, even when you're sticking to tight time frames, always keep the line of communication open with patients and family members. It's really good idea if you're the executive on call, you're the quality person, if someone's got your contact details as well, that they can contact you outside these time frames as well. That goes a really long way into making things better as well. Thank you so much, Alex. The next slide. So in addition to the Commission Open Disclosure Framework, like I said, there's the Safer Care Victoria edition plus the Duty of Candor. The Clinical Excellence Commission has also got a program as well. And there's also some great videos on YouTube from the Commission, and they're actually there from all the different departments of health. And most of them only go for about 5 minutes too, if you want to do a little introduction to people as well for your clinicians. There's also open disclosure training for free on Safer Care Victoria website, as well as the Duty of Candor training as well. Requirements for accreditation. Purpose of accreditation, what do we need to do to show compliance? So as I've got here on our next little slide, we need to have a policy and procedure, or whatever you're calling them in your organisation. We need to make sure that all the relevant staff are trained and that management is aware of the compliance rates for the training. So, for example, you need to know, if you're the exec of the service, that everyone that should have done the training has done the training. Next, are you recording open disclosure? Like I said at the start of the talk today, how do you know? Can you look back and know when it occurred? Because part of this is also evaluating it. And as I said, if you haven't recorded it, we can't evaluate it. Now, what I'm talking about, the open disclosures, is we're really mainly talking about the high-level disclosures here. So often if you've got a paper incident report, for example, you might have a box to tick that open disclosures occurred, or you might have an electronic system like Wristman, for example, and that can have a tick box as well. So how are you reviewing the actual disclosures that occurred to make sure they're done well? And how can you evidence that any lessons that you've read from this have been done? Now, I'm going to ask you the questions. If I'm your assessor, what's your process? What improvements have you done to this since last assessment? How have you involved consumers in the process? How do you monitor it? And how do you report it? Now, remember earlier I discussed the Open Disclosure Organisational Readiness Tool, assessment tool. This is a tool on the Commission website. Please, please, please download this. It's 2 pages of items to check, and you rate your organisation for each action within these 2 pages from 0 to 4. So this is fabulous. It not only gives your organisation peace of mind that you're actually ready for open disclosure, but it also answers Part B of Action 112 in the National Standards, which is around monitoring and acting to improve the effectiveness of the open disclosure process. Thanks, Alex. So what do you do now if you're still confused? You can contact the Australian Commission on Safety and Quality in Healthcare. They have an email and you can ask them any question about anything. You can contact QIP and they'll get on to somebody to answer your questions. You can network, so get onto your Department of Health, or you may be part of some other network that can help you. There's all sorts of people you can reach out to. Thanks, Alex. So I've got, hopefully you can see my slide now with lovely Florence Nightingale. And I just wanted to mention that, as we discussed at the start, none of us intentionally come to work to do a bad job, but harm does happen. So look on the Commission website and other places we've discussed and make sure you've got some tools readily available to help clinicians through these really stressful times that can occur. And the Commission have also a document for clinicians that you can adapt for yourself, and that's called Just-in-Time Information for Clinicians. Thanks, Alex. I hope, have we got any questions? Can you see if we've got any questions coming up on the chat?
I'll just have a look. We had a question to make sure that we will provide the recording of the webinar and the PowerPoint available after the session.
Absolutely. And we might even, because we've had such terrible technical issues, with people's permission, we'll probably re-record this seminar, and we'd be only too happy to send out the tools that I've been talking about. Really happy, because they're absolutely fabulous, Alex, and everything you need is sitting there. I'll be only too happy to share that. Yes.
At the moment, I'll just wait another second to see if we have any other questions. There's one: how do you determine the difference between a low level and a high level incident?
Perfect question. So look, usually it goes on the level of harm, to be honest. So if I used my example of a fall, if someone's had a fall and they've just grazed their knee, for example, then I would just be having a conversation. If I've had someone fall because, for example, like I spoke to an assessor the other day, and she was in emergency department, and she was having a drip. She had a drip put in because she was fainting, and they'd had the cot sides up. And we were having a giggle because she had to climb over the cot sides to go to the toilet. Now, this happens in our hospitals all the time, right? And we have someone fall over and break their hip. That may be a high-level open disclosure. And what you do is, if you have a look at that flow chart, what you can do, if you're not too sure about which way to go, you start off with the low level and then ask your patients, ask your carers, are they happy with how things have gone? There's never any harm in doing a higher level disclosure at any time, as long as they are willing participants. Now, when you have a look at the Duty of Candor program for Safer Care Victoria, they actually have a formal document there for people to opt out, because that's the other thing is I may not want an open disclosure. Even if I've had major harm, I may not want it. So again, you might have formal processes for me to opt out, or I might just be happy. I might have had a terrible thing, but I might just be happy with a quiet word. So to recap, all of that is that it's usually upon the level of harm, but also my expectations and my wishes as the patient and the carer. Great question. Thank you.
Thank you, Amanda. There's another question here with, when doing accreditation, where do you find the biggest gaps in open disclosure process to be?
Yeah, that's a very good question. To be honest, the Part B, to be really honest, most assessors are not assessing Part B of the question properly. Most of the times, you'll find assessors will just look at your policy, your open disclosure policy, and look at the training. However, if you are being assessed robustly, can you actually evidence the Part B? And that's why I've given you that secret weapon of that tool from the Commission, because most of us are not doing Part B. The other place where we find gaps is people not performing open disclosure, not understanding that an open disclosure needs to occur. But the biggest gap, like I said, is not evaluating the process. Great questions, aren't they, Alex?
Perfect. Great. Thank you. I'll just see if there's another one. Anybody has any more questions? That might be it for us, Amanda.
And again, my apologies, everybody, for my technical difficulties. You wouldn't read about it, would you, Alex? But if you're okay, Alex, I'd be very happy to record that again so that there's no background noise, and also very happy to get together all the documents if that makes it easier for people. But cannot recommend going on the Commission website enough, and Safer Care Victoria and the CEC. There's outstanding information out there.
In our presentation, when we get the recording and PowerPoint together, I can include the resources as well for you.
That would be awesome.
And with the survey currently up on the screen, if you want to do the QR code, there's an opportunity, the last question, to tell us if you need more information on anything in particular. We can help provide that and get you in touch with the things that you need to know.
Yes, really happy to talk to anybody that wants more information. But like I said, my biggest advice is to have imagine something's gone wrong, get everything you need together to make it easier for the clinicians at the time. Anything that makes it easier is a good thing.
Great. So much, Amanda. It was always wonderful to have you on our webinar.
Love it, and it's been lovely. Great questions, guys, and please keep in touch. Reach out to QIP if there's anything you need whatsoever, and have a lovely day.
Thank you.
Thanks so much. Bye-bye. Bye.